is the work ethic of these doctors and what they are going to be coming with. Denning just mentioned the environment, and he says that with the current state of our hospitals across the country, it will be impossible for these doctors from Cuba to function well within the framework of the agreement, that is 2 years. Then, given the state of our hospitals, are we likely to see the derailing of this agreement, the coming to forth of, again, new excuses by the government? Because at the current situation, it looks like they are not going to be able to decongest the kind of population that we have in hospitals seeking medical attention, but at the end of the day, they do not get adequate medical attention.
I think the fact that the doctors are coming,
yeah.
We should first of all consider the presidential agenda 4 slogan. Yeah. The Jubilee government is trying to work on that, but they are not facilitating what is required. Yeah. They are doing very wrong prioritization of things, such that, for instance, the cancer therapy, the cancer drug nowadays is said to have been established. But who did it? I don't know whether you know he's a Kenyan, by the name Joroge, from here, Githunguri. But where does he do his research from? Not in Kenya. Why? Why can't we import back our people first before we go to the Wazungus? Yeah. So what I'm saying is, without the infrastructure, without the facilities, without the proper environment in our hospitals, the Cuban doctors will not solve any problem here. They're just coming to collect money and then go away after the contract. The best thing is, let us have contracts with our own doctors, and let them be paid on contractual basis. Yeah. So that we even have newcomers or the new generation coming up and getting over with the job. What do I mean? For a doctor in a medical facility, let him be given 10, 15 years to work. After that, let him be facilitated in other things like teaching newcomers, so that, because our generation, our population is growing, let all the doctors we are producing get a chance to at least practice. And this way, in fact, I believe practice makes perfect. The more we include, the more we involve our own doctors, the more they'll be happy in the job, and the more they will grow in that profession. Okay. I don't think the Cuban doctors are coming here to do miracles. I don't think so.
Okay, Andrew, I'll come to you. It would have been simpler, isn't it, for the government to seek an alternative path, which is a simple one in terms of sending more doctors, numbering more than 100, because the Cuban doctors are 100, more than 100 Kenyan doctors to Cuba to be undertaken to, specialty courses, come back and then inject that experience back into the country. Was it a case of a priority misplaced by the government and President Kenyatta in particular to attain universal health care? Because it appears as we speak that the work ethics that they are going to be coming with and the protest from the Kenya Medical Practitioners and Dentist Union, that they are not going to be solving the problems here in the country because they are long-standing, they are deep-rooted, and need urgent attention from the state.
These Cuban doctors, who are they going to work with? They're going to work with Kenyan nurses. Which support staff are they going to use? They're going to use the Kenyan support staff. Now, these Kenyan support staff and the Kenyan nurses and the fellow doctors in Kenya have rejected them, clearly. If you are working in Turkana County and the doctor there is not ready to support you, probably you're supposed to be doing a surgery. You need a team of doctors. You're not coming with Cuban support. You're going to use the Kenyan doctors, and he has refused. Now, this will still be hurting the common patient in the hospital. This is what the Kenyan government should look into. By thrusting by force through the throats of Kenyans or through the throats of doctors that you have to work with these Cuban people is not going to help us at all. And in fact, it would be better if we sent our own doctors to Cuba to get specialized education on specific diseases. We have diseases such as cancer, specific diseases that our doctors maybe are finding challenging treating. The issues of infrastructure, these are the things that the government should put a lot of weight in. Now, I'm asking myself a question. A student of medicine or student of nursing or a student of pharmacy who has taken 6 years at the university, where is he supposed to take all this knowledge? If 5,000 of them have not been employed, where are they supposed to take this knowledge? And who are they? In fact, I meet most of my friends who went for medicine in the university. They're working in pharmacies in town just to put down on paper Panadol and stuff like that. The things that they learned in the university they're not putting into practice. Things like medicine, things like engineering, things like law, they require constant practice to have it in your mind. Now, the government should be very critical on this matter and should go back to our universities. If they feel that our teaching or our training is not sufficient enough, they should put down a policy that ensures that immediately after 6 years of training in our universities, we can send a few out of the country or into more developed economies to ensure that we have the right specialized doctors to treat our patients. But the issue of bringing in Cuban doctors, one, because they will not find a proper working environment through the sabotage of our local doctors, our country will still be hurting. And I think that's a very wrong move.
Okay. Denning, I'll come to you. It appears that the importation of the Cuban doctors has attracted criticism from the Kenya Medical Practitioners and Dentists Union and also quarters of the public and pundits who say that the government was not right in going for the Cuban doctors and instead could have tapped the availability of resources in the country. Then it also is important, is it, for the government and the state to inject more money into research of our universities to produce quality doctors who will help address long-standing medical issues that continues to affect the people across the country. Because what you see when you go to hospitals like Kenyatta are long lines of people, and the availability of doctors to give their specialty, considering the ratio of the doctor to the patient, is a bit worrying. And is it important then for the government to inject all this money for research to have quality doctors who can address local problems locally?
Of course it is. And when you look at the money that is going to be spent on those Cuban doctors, of course, it's a lot.
About 2.5 billion.
Exactly. And it's only a 2-year contract. You see how short that is. So in short, government is thinking in a short-term way. However, if government was to go the better way and a way in which indeed it wants to improve the medical aspect in our country, which is among the Agenda 4 of the President and a very important right in our Constitution. We have KEMRI, the Kenya Medical Research Institute. This is where the government should pump a lot of money to assist in medical research, come up with most of the solutions to the diseases that we have, that we suffer as Kenyans. Another problem is the frustrations that professionals go through. See, you've been through medicine school for 8 years. You come out here, you are paid peanuts. You know, well, peanuts is relative, but as a professional who's gone through school all those years, you need to get good remuneration. What happens is, if you come out of school, you are being paid almost nothing. You prefer looking for jobs outside the country. And this is the brainwash that we are seeing. We have very qualified professionals who opt to go and seek employment in other countries. And as Kenyans, we remain here with people who really are not qualified.